savvy.
I'm going to go in my gym in a minute and show you guys some of those movements. But I wanted to touch on something first that somebody had messaged me about the other day, and I've continued to think about, and I kind of want to put out some thoughts on it for you. And basically, this person experienced prolapse after her first birth and then got pregnant pretty quickly, like within a year with her second. And so she's early on in that. But she was feeling a little bit distraught because her appointment with the OB, which I believe was with a PA, in short, told her, your pelvic floor is screwed. There's nothing you can do about it now. It's just going to get worse through this pregnancy. That's why women need to have C-sections, because when you have babies this close together, this is what happens. That's a really garbage response. There's no shortage of that for sure. I guess my number one message always is advocate for yourself and do what you think is right. And that doesn't mean that you're just looking for the answer that you want, but you're looking for somebody who's reasonable and listening to you as a patient. And I understand that providers have a certain level of education, but sometimes I think that in medicine, they believe that they kind of know what's best for you. And I think there just needs to be some better dialogue within advocating for patients and also providers understanding that patients have a certain route that they'd like to go. With that said, there's lots of stuff that you can do to maintain and prevent or try to prevent prolapse from getting worse, whether you're pregnant or whether you're not pregnant, but you're really looking to pursue some conservative routes to maintain that pelvic floor integrity. Prolapse is very multifactorial. Yes, the more pregnancies, there is more incidence of prolapse. However, there's also women who don't develop prolapse who have had lots of pregnancies. And so kind of trying to figure out what some of those differences could be. We also know long push phases, episiotomy and tearing, very large baby, birth weight, can all be things that can relate to a higher suggestion that you might develop prolapse. However, we also know that intra-abdominal pressure is really important to maintain and understand, as well as tissue tensions in the body and how that contributes to prolapse, which I've spoken about a lot on here as well. And if you're looking at a conservative management of prolapse, whether you're going into another pregnancy or not, there are things that we can suggest to you to do that would give you a little bit more control over those things that you can control. So if we know that one thing that I kind of just pointed out was mode of delivery and how that delivery goes can impact your pelvic floor, we can definitely teach you and advocate for better birth scenarios for people, which includes getting off of your back, open sacral positions, understanding how the pelvis moves during different phases of birth, early in birth, in the later phase of birth, how to breathe to relax your pelvic floor, because if we're pushing, we're actually going to put a ton of pressure down on the pelvic floor as we're delivering during birth. You could gain so many avenues of understanding what pressure control looks like in different movements that you're looking to do, so you can continue to stay mobile, healthy, and strong to support the pelvic floor as we will naturally gain weight and change our center of gravity. In short, that's a really horrible response. I think there's a lot you can do to improve your odds and maintain as much as you can learning all of those things that I talked about. And if we can advocate for different birth practices and really educate people so that they understand the why behind it, which is what I feel is really important. When we talk about at a biomechanical level what's happening at the pelvis when you're lying on your back, it might make sense to you why there's so much more pelvic floor issues when we deliver that way. And you might choose to do something different. You might push a little bit harder against that provider to make that movement happen for you. Speaking of which, I did just record a video. I just need to finish editing it, so I'm going to try to get that up soon. That really just shows you a little bit about what happens at the pelvis that you can utilize early in birth versus the later phase when we're looking at the push phase. So advocate for yourself. You can go to pelvic floor therapy during pregnancy. I highly suggest it. It's always beneficial. Okay, the movement at the wall, before I go into detail, I got to give you a little bit of background. It is a postural restoration movement, and it also goes along with their teaching, which I'll give you a little background on to understand the why, is that most people fall into a pattern of pelvic torsion because the body is not naturally symmetrical the way our organs are laid out. And when we fall into this habit, there are muscles that are chronically turned on and others that are chronically turned off. And typically it is a left hip flexor that is on, we have some glutes that are off, a pelvic floor that is off on one side, and the fact that we can't move in and out of a reciprocal motion of the pelvis. And because when certain muscles contract because of their orientation of the fibers, when they move, they create these different movements at the pelvis as well. And if we're not getting reciprocal firing, we're seeing dysfunction and other issues arise. The whole idea is activating muscles that have not been working and turning on and inactivating the other ones so we can create reciprocal motion at the pelvis. And so this one is a little bit more advanced one. It's not where you would start, but since a lot of you have asked, I'm going to stand on my left leg and I'm going to slightly drop my right knee. Now I'm completely stable on my left leg. I'm making sure I feel my left inner thigh because that's going to help my pelvic floor ascend. I feel my outer glute. I feel all corners of my foot pressing down. And when you drop that knee, you're still going to side bend to the left. I feel my core working, my internal obliques and my TA. And then I'm going to press my right heel into the wall and externally rotate. And then from there, I feel the fibers of my glute max activate. I'm going to hold and I'm going to breathe. Something else I wanted to clarify today, and I'm going to stop with my stories because I'm going to annoy myself. They're so long. If you were confused about yesterday's video, in essence, I want you to think about when your butt is squeezed and clenched because you're using those muscles to support yourself. Your pelvic floor is from here through here at your sits bones. When you clench that, you're closing it off. You're creating posterior tension. We're narrowing this space. And if your pelvic floor is a trampoline, it's not going to rise and lower with breath because we're constantly restricting that. And it changes the way everything else then relates to each other. So first we need to restore and release tension. And that's by moving in the opposite direction of external rotation into internal rotation to reduce that tension from this to this. Preparing for birth from a pelvic floor PT perspective. Understanding how we can use movement to influence our pelvic position during different phases of birth. Movements that promote external rotation can be great in the early phase as baby is descending down into the birth canal, making more room in the...
You want to know the best position for labor? The truth is, the best position is one that is changing every 20 to 30 minutes. Here are a few of my favorites.